another perspective on the challenges and potential solutions in the staffing crisis facing Minnesota's nursing homes and long-term care facilities, I spoke with the chair of the Human Services Committee in the House, Representative Jennifer Schultz. There is a staffing crisis in caring for people, whether it is people with disabilities, the elderly, or the infirm. Big picture, in your view, how dire is this crisis?
Well, first of all, thank you for having me on this Capitol Report episode. Really glad to be here to talk about something that's really important to our state and to many of my constituents, and that is long-term care. And we definitely do have a staffing crisis. Actually, we had it before the pandemic. We have over 13,000 job openings in long-term care in healthcare occupations, and we are determined to start tackling that issue this session.
Long-term care facilities have been sounding the alarm about the difficulties in finding and retaining staff. According to MinPost, 76% of providers are limiting admissions. The percentage is 90% in greater Minnesota. I've heard testimony that some facilities are actually closing. Will incentives proposed by Republicans, they had a press conference last week, incentives like bonuses, grants for training, and loan forgiveness, is that a positive move in the right direction?
Well, we need to start somewhere, so it's a good start. We did put in over $50 million last December and earlier this year into a fund to help retain healthcare workforce and to provide bonuses. And we found that worked somewhat. It took people from other areas of healthcare into other areas of healthcare. So we really need to bring new people in to the healthcare workforce and to the caring professions. So one thing that we need to do, besides the Senate is offering one-time bonus payments, that is not a long-term fix. So what we're looking at in the House is to increase the reimbursement rates for providers and the long-term care facilities so they can then pay higher wages and offer a greater benefit set. Benefits like tuition reduction or repayment, child care, medical, long-term care insurance, retirement bonuses. So we really want to do a lot more long-term on a permanent basis to attract new people to the caring professions.
And as it stands right now, do most of these positions lack some of those benefits that you laid out, retirement savings, health care plans? Do many of these positions lack those sort of basics that many professional jobs have?
I believe many of them do, especially if they're entry level or mid-level. So I think that because historically, reimbursement rates for programs like Medicaid or medical assistance have been low and not keeping up with medical inflation. A lot of providers are just not able to offer that benefit set. So we need to get help from the federal government and put more investment at the state level into these reimbursement levels that hopefully will translate into higher wages and greater benefits.
Now, you mentioned that the wages need to come up, that we need more workers to come into the system. We're also looking at a demographic shift with baby boomers aging out and perhaps fewer younger people even available. So there's going to be a lot of competition for other jobs. Why should people pursue these kinds of jobs?
Well, many people find them very, very rewarding, even though they can be grueling. They're very rewarding. And so I think people want to have value in their professions, and many want to go into this occupation even with lower salaries. But we need more people moving to Minnesota. And so we need to attract a working age population to Minnesota because we do, as a state, have a higher age demographic. And so we need to make Minnesota an attractive state, and we offer a lot of great benefits, and it's a beautiful place to live. But we should be opening our arms to refugees and others who want to come to Minnesota.
And in a prior answer, you mentioned raising rates and Medicaid and working with the federal government. I know that this can be very confusing for people trying to navigate when they need services for a loved one. What can the state be responsible for when it is a collection of state programs and federal aid and all of that? Can you explain that to the layman?
So right now, Medicaid is a state and federally funded program. In Minnesota, it's 50-50. So whenever we increase the reimbursement rate for Medicaid, for instance, 50% of that will be paid for by the federal government. And that's why, as a strategy to increase that reimbursement rate, we're going to get 50% of that paid for by the federal government, rather than these one-time bonus payments, which is all state general fund. That's why it is really attractive to increase reimbursement rates, because we're getting the subsidies from the federal government.
The strategy up to now for the people as they get older is to age in place. With a shortage of caregivers to just come in and do the daily tasks or other things, does the strategy of age in place need to change?
I think a strategy of making sure people can stay in their homes as long as possible, that's what most people prefer to do, is the right strategy. It is much cheaper to provide home and community-based services for people to stay in their homes than it is to put them in a nursing facility. So it is the right strategy. All states are pursuing that. Minnesota historically has been a leader in this area, and we just need to make those investments. So states like Washington State created a public-private trust fund to provide people some coverage for those long-term services and supports to keep them in their homes longer. Minnesota should be pursuing something similar. So whenever we can make those investments, and we received over $650 million from the federal government last year to invest in home and community-based services, we're going to see that pay off, and we need to continue those investments. But we really need to change how we think of the caring professions. That we need to value them more, and that means prioritizing those investments and making sure that they get higher wages and greater benefit set. We've really undervalued the caring professions, and they're so vital to our community in Minnesota and across the country. But we also have to kind of decide how we're going to change, for example, housing development. So we can provide multiple generations that can live together and care for each other. We really need to change how we provide housing and make it much easier to age in place by having mother-in-law apartments or accessory dwelling units on the same property. So really change even apartment buildings that houses young college students, for instance, and older adults, so they can help each other.
Yeah, I have read some about some of the ideas for communities like that of mixed people to help each other out. Oh, in the Wall Street Journal this weekend, there was a very fascinating article about Amy Goyer, who is the family and caregiving expert for AARP, which is the American Association of Retired Persons. She actually had to file for bankruptcy because of the expenses she incurred in caring for her two elderly parents. And it brings up the question of the unpaid work that so many people do for family members, or they go into debt themselves in order to provide services that maybe are available somehow, but the web of understanding how to access is so challenging. What are some ideas to perhaps help with that?
Yeah, I can really relate, because I'm in that sandwich generation where I'm taking care of young children and looking soon to be taking care of aging parents. And so it is a real problem. And what first needs to happen is we need to make sure employers can provide paid time off. So paid sick time, paid time to do this caregiving, so people don't lose their job and they can maintain their salary or wages. That is really vital to making sure people don't have to declare bankruptcy, but also valuing that more. So maybe tax credits or some sort of financial aid to get them through those periods where they do have to provide more care to their aging parents.
Representative Jen Schultz, I want to thank you so much for your time today.
Yes, thank you for the interview. Really appreciate it.